welcome, and Abby, welcome. Oh, good, Brooke's son, Brooke. I don't
Oh,
think
okay.
you've heard
So they're father.
the history either. Okay, so now we're getting a little quorum here.
Yeah.
Okay, so I want to welcome all of you to our small but very smart and very mighty sustainability group. Those of you who are new to this group, I want to just give you a little bit of history. There was, Jill, help me out with dates. I think it was about 5 years ago, ACL funded sustainability toolkit projects, and 5 different states engaged in sustainability planning. And after those grants ended, a few of the leaders, Sharon Johnson Grow and Cheryl Smith and Mary Jo Alamena Caruso, got together with art staff and talked about how to support other states in sustainability planning.
And Amy is there too, since we want to make sure Massachusetts was represented. And
That's right. Yeah, Amy is
Yeah,
there.
also a leader of the
Yeah.
sustainability group at the beginning.
That's right. Amy was one of the key people, and one of the people that personally informed me and taught me a lot, shared a lot about what Massachusetts learned during that process. So this group came together and formed these goals in 2018. And I have them on the agenda. Learning Collaborative members will develop sustainability plans or will refine or complete existing sustainability plans. This one's been tricky both during the grant period and for states. It's such a monumental task to actually write the plan up, even those states that have done a lot of planning. So New York is a notable exception, and Dr. Caprio worked with the New York group and presented actually the work that they've done at the International Research Summit that ARCH sponsored at the end of September. And it's really impressive what New York has accomplished. And they did this partly through having an outside facilitator and someone who's a researcher who's willing to write up the results, which is admittedly a monumental task. But that's the idea that you will engage in sustainability planning and write a plan eventually, or revise a plan. The next thing we wanted to do is identify members and tasks necessary to develop, complete, or refine sustainability plans. So at the outset, we used this toolkit from the Finance Project. Massachusetts has one. I think New York has one. Brooke, did we get you a toolkit, or do you want a toolkit?
I think we do have one here in Montana.
Okay, so a little word about the toolkit. It's an excellent product. It's completely well thought out and very prescriptive. The states that used it for the project, and they had actually money to fund them using it, struggled with it because it was so labor intensive. So what we've tried to do is take the good stuff from that and make it usable. So borrow of that. So it's definitely worthwhile looking at it, and call me and I'll help you adapt it if you want to use parts of it. I would be familiar with it, but unless you have tons of resources, it may be hard to actually implement it. Good morning, Tracy. My other Washingtonian, so it's kind of early and gray for us. So Tracy, I'm just welcoming new members and giving a little history about the sustainability group. And so the third goal that we had is that collaborative members would actively ask questions, share progress and written plans, and share knowledge with members of the Learning Collaborative. This was our hope at the outset, and you've more than surpassed our hopes. This group has been really active, really engaged, really productive, and incredibly supportive of one another. So that's a little bit of history. when we do bring, brag, and borrow, you'll learn more about each other, and you can brag about your own work. But the way this has worked is that people have been really detailed about their work, what they're working on, and how it fits in with sustainability. I know, like Massachusetts is just doing um, interesting, ambitious, important work on data collection across agencies. They shared at the research summit. I've just been going through writing quotes from you, Leanne, and your colleagues as I'm helping to work on summarizing that report. And I think that we're all going to benefit a lot from that work you're doing. The whole field will benefit. And what I found is that across the board, all of our members, I've seen the cross-fertilization and the growth in the group and the productivity. So, and that's because of your hard work, but your generosity with one another. So I just want to say thank you for that. We usually don't do a little mini lecture. We usually just go right to sharing, but I wanted to take time today to share a little bit about COVID. This came up again and again in the research summit as something that's really important. And if we go back to the toolkit, one of the first tasks of doing sustainability planning is identifying what you want to sustain. And I think all of you know that. I've seen your grant projects, your proposals. I've heard from you. This is a group that has a clear idea of what your goals and objectives are, how you're going to achieve them. And it's also a strong group in terms of measuring and getting leaders together to carry this out. But we're in a time of great change, and I don't think that it's going to end soon. And some of the conversations I hear are that the changes that that you're making in your states and in your programs because of COVID are things that you might want to continue. So I thought it would be worthwhile just to share this bit of data with you. The data set that we have is huge, and it's qualitative data. So this is just a glimpse at it, and we'll have more detailed information for you, but this can get you thinking. So there were 3 big findings from this study that Kim Whitmore conducted through the Break Exchange in cooperation with ARCH. And she sent surveys out across the world, actually. We received about 500 back from 8 different countries. And the data, the sound data that we have is just about 300 responses, and they were open-ended responses. So we have a lot of rich qualitative data. So we coded all these data. We had preconceived codes, but that as we went in there, the codes changed and evolved over time. And the 3 things that stood out of the myriad codes that we had were, 1, programs didn't drop services. They didn't do nothing. A few did, but the majority rapidly adapted services or created alternative services. So this was really impressive to me, how rapid and how facile the systems were, and how willing they were to change, and how funders were willing to allow different services. So within those, we're seeing kind of 5 different things. And they seem to be on a continuum of least to more supportive. And the first thing that happens is that programs reach out, they just do a check-in. They just reach out via telephone or email. They're proactive in maintaining a connection. And then some programs actually do risk assessments or telehealth wellness checks on the telephone. And the second thing they do is resource referral. And these are all respite programs, remember. So the programs seek to reduce caregiver burden by helping caregivers connect to a variety of community resources. They do written lists, they do social media, they do individual referrals. And so what those look like would be important, I think, to all of you in terms of service delivery, but this is just sort of the gist of what they're doing. The third thing they do is provide self-care guidance and support. There's a lot of this, and a lot of this has to do with actually creating activities, doing them over Zoom, or sending activity kits home, but they also do just guidance, anticipatory guidance. Okay, Here's how you can create space for yourself. Here's how you can take time. Here's how you can use technology. And then they help families navigate services, kind of coach them. The fourth thing, and this was a big one, that I haven't seen explicitly in respite programs, but respite programs are now explicitly thinking about this. They're very actively creating support groups, referring to mental health professionals, providing virtual resources for coping, and organizing weekly caregiver webinars. And then the practical support is the fifth thing. And this is hands-on, delivering groceries, delivering pharmaceuticals, delivering meals. And if they're not doing this themselves, they're arranging for it. And a lot of programs are doing basic needs baskets with, toiletries, activities, that kind of thing. So when I did this, I just happened to come across this evaluation. I think I was hearing Sue Peshin, who one of our presenters in the research summit, and she talked about this report. So I went to it and I was reading, and I've just noticed that this report, this outcome evaluation of the National Family Caregiver Support Program, mapped on really closely to the alternative adaptive services that respite programs are doing. So the things that they provide are information for caregivers about available services, assistance to caregivers in gaining access to services. So you can see that in the resource referral and self-care guidance in respite responses, caregiver education, training, individual counseling, and support groups. So this is common to family caregiver support programs, but maybe less so in terms of respite. And then they provide respite care and the supplemental services, transportation, home modifications, and medical equipment. And that's not the same as the food delivery and pharmacy delivery, but it is practical support. So those of you who have the handout in front of you, I just did a little screenshot of one of the pages from this Caregivers in Crisis report, Caregiving in the Time of COVID. This just came out from the Rosalind Carter Institute for Caregiving, and you have I put a link in there to the report, which is quite interesting. So on this chart, you will see that the caregivers responded that their receipt of adult respite daycare is way down. So one of the things that says to me is, now we don't know if this is the same group of caregivers. It's not the same group of caregivers as the care providers, right? Ideally, you'd want to ask the care providers and the caregivers from the same programs and see how they perceive what they're getting. But so the respite programs are providing something, and we like to think that it gives a break in some way. The care receivers don't perceive that they're getting respite. So it's a kind of definitional issue, and it's also it also raises questions about whether or not what we are doing during respite is helpful. I mean, we're trying to be helpful, but we need to ask those questions, right? Like whether or not it's translating to something helpful for families. So in terms of sustainability questions, these are just questions that we came up with as a research team as part of this program. Have your programs made these adaptations or offered alternative respite services? So do you have an idea of what's going on in relative detail in your state during COVID? And of the adaptations you have made to services, will you maintain any of them after the pandemic has subsided, and why or why not? And I don't expect you to be able to answer those questions, but there's definitely worth asking. And then the second thing that we found that was really strong in the data from the survey that we did is that stress was a huge issue. And what programs told us is that they are socially and emotionally close enough to caregivers. This really actually impressed me. My background's in early childhood special education, and a few years back, I was part of a 5-state, 5-university research consortium that looked at mental health in early childhood. So we went into schools and Head Start programs. And in Head Start programs, about a third of the mothers are clinically depressed, but the programs didn't want to touch it. You know, they were like, we're here to educate children. And of course, children and parents are an essential partnership, as are caregivers and care recipients. And this kind of may seem like a no-brainer as I'm saying it, but has profound impacts because those programs did not want to take on mental health, despite the effects it had on children, on their cognition, on their social emotional development. And they're starting to do that now, but this is like, I edited a book on this 9 years ago, and a school district contacted me this year to start, you know, doing a school district-wide program. I saw the opposite in these data from respite programs. The attunement to caregivers and care receivers, but particularly to caregivers, and the willingness to jump in, the acknowledgement and the kind of fearlessness and the lack of hesitancy in trying to find support was so impressive to me. I just thought, I mean, I love respite. I love the people in respite. And this was really actually uplifting to think about the responsiveness of the respite system. It's a great worry to providers, and it's stressful. There's secondary stress and there's secondary traumatization when you're a provider and you're seeing families in distress. So just something to think about and watch out in your systems. So some of the sustainability questions we came up with: what guidance and support are you offering to caregivers in your program with regard to safety, with regard to support services, and with regard to social isolation? What guidance and support are you offering to volunteers and staff on work-related stress and or compassion fatigue? This is something that came up in the data a lot. And are work-related stress and compassion fatigue something you thought about before COVID-19? And if so, did you incorporate ways to address these in your programs and services? Now, I probably should say at this point, we're looking at kind of fine-grained service delivery, but I think about respite in terms of a human ecological model. So this speaks to access issues in respite, like the first person that has contact with a family and what kind of contact they have and what kind of support do they give. It speaks to training, personnel preparation, staff support. And these are more systems issues. These are things that we do think of at a higher level and hope that they make a difference at more personal level between caregivers, families, and programs. The third big thing was technology. This is the key vehicle for providing respite services. And there are barriers among aging populations, people who don't have money for technology or up-to-date technology. So those were things to think about. Those came up a lot. And then one of the things that a couple of the questions that we came up with as a research team is technology satisfying socially and emotionally for caregivers and families and for staff and volunteers? And will you and how will you continue to use technology after the pandemic subsides? So that's it in a nutshell. Feel free to unmute yourself if you have any questions or if anything rings true.
On that last part, Susan, you said you asked them, is it that the technology, I missed it, I was writing as you said, so what is it that you're asking them if they'll continue to use it after COVID?
Will they continue to use technology? So kind of distance support, or for example, for the case management kind of piece, for resource referral, technology has been really big in that, and it's been really big for support groups. Is that something that programs may continue after this occurs?
That's
Okay.
really interesting. Yeah, even just to that, so I was just at a meeting recently. We were talking about the use of telehealth with mental health services and how the no-show rate with telehealth is greatly decreased from the in-person
Oh,
and
interesting.
just overcoming. Yeah, and I wrote down the stats on what we were finding, because what Massachusetts has been finding is that the number of individuals who have a telehealth appointment with a mental health provider, and many of this is stress related because caregivers, the children with special needs, that they're not in the group, the day programs in the schools and things like that. And so, but what we're finding is that there's a greater completion rate with the telehealth. So it's something that Massachusetts is definitely looking at sustaining long-term, only because of that. Now, there are the issues, of course, if there's domestic violence or abuse in the home, or the person that you're having to speak about is in the home. So there are those
Right.
challenges that you would need to overcome. But
Right.
yeah, so it's just interesting data. So this is very interesting report. Thank you for sharing this.
You're welcome. It makes you think, doesn't it? It just,
Yeah, it absolutely does. Yeah. Yeah. So is the full report available to us?
oh, it. We're still analyzing data. It will be available. And we'd actually like to collect more information. Like, we'd like to do some focus groups with providers. This was taken at the outset. This was taken, I think, the data were collected in April, I believe. And so, yeah, and one might ask why it's taking us so long, but it's
Okay.
been like herding cats, getting their research together, team together with
Yeah.
all competing interests, but it will be
Yeah.
relatively soon. And
Okay, great.
we'll share it with
Looking
you.
forward to it.
Yeah,
Looking forward
thank
to it. Yeah.
you.
Good, yeah.
Anybody else have any other comments or questions, or is this ringing true? These data, do they ring true to what you're doing in your states? Similar? They're a little
Absolutely.
more-
I have a quick question for Leanne. Where was that done just for Massachusetts, what you were saying for the telehealth visits? And or did you notice if it was for other states, just out of curiosity?
Oh, yeah, no. So it's in
Just trying to Google you.
Massachusetts. Yeah. Pardon me? Yeah, so it's strictly for Massachusetts, and it's just a group of state leaders. We have the Healthcare Collaborative, and they come together, and it's comprised of all the state leaders, and they were doing they were looking at outcomes of what was happening across state services, whether it be with the Department of Mental Health, Department of Public Health, and so that is just one of the reports that had been given at this particular meeting, was that I'm still looking for it in here, but yeah, that the completion rate was much higher through the telehealth visits. And this is through talking with providers and things like that, is that typically, I think, don't quote me on this, but I think it was like a 5% or a 15% no-show, and that they're finding it was like less than 2% through telehealth. So I will find it by the end of this meeting and tell you. But yeah, so it was very, very interesting results. And so we are looking at the number of parents that are showing up at the emergency rooms and other things, seeking some sort of respite or some sort of services. And, how do we come together and provide that? So this is part of not only what our Lifespan Respite Group is doing, but trying to work across state agencies that are also trying to respond to this need. And as far as like what's working during COVID and what, so yeah, it's interesting. We're certainly learning a lot, right?
So Leanne,
Go ahead, yeah.
when people show up and ask for respite, have you in Massachusetts figured out a workable response to, or you're just kind of puzzling about the problem at this point, or anybody have any great ideas about that?
Yeah, so right now, and that's a great question. So we have about 7 state agencies that provide respite services, and the Lifespan Respite, as you know, we've gotten a core group of state managers from each one of those agencies, and we've been meeting. And we are at this point really disseminating the information out. So the other groups in Massachusetts that are working on different projects are starting to hear about this group just through us sharing of things. And so I guess to answer your question, have we been able to respond to it? We did a crosswalk, as you know, about a year and a half ago. We
Mhm.
looked at how we define and disseminate services. What we're doing now is we are developing a one-stop shop in
Mhm.
Massachusetts, and so we will be having a call center. So anybody that's looking for respite services, or if they're looking for services, they can call this one number, because what we've learned is that families trying to navigate the system,
Mhm.
it's been impossible. And then also state, like the caseworkers, the case managers, they're not real. They're aware of what's going on within their agency, but they're not aware of what's going on in other, or what's available at other agencies. And so this core group of state managers, we actually have a meeting on Monday on how we will have this central place for family caregivers to go to. So if they
Mhm.
call this, 1-800 number, whatever we decide that it is
Mhm.
the operator will be able to say, ask them questions to determine if they're receiving benefits from Department of Mental Health, Department of Elder Affairs, Children and Families, whatever it is,
Mhm.
and be able to point them in the right direction. So that way, it's not left up to the caseworker at the one agency to try to figure it out. And that's what we've learned. We've been doing focus groups with the different teams, and we've learned that the caseworkers or the care coordinators are trying to help the families to navigate the system, but they just don't know enough about what's happening at the other agencies. And so
Right.
that's why we had this one central location. The
Yeah.
other thing that we're doing is, and I wrote it down, I'm interested on your report, is we're looking at how with professional development and what the state agencies are doing, whether it's with their onboarding or how do they train their personnel to be aware of the different programs that are available. And this is not even just with state services, but this is also with like natural supports. So
Mhm.
looking at things like charting the life course nexus and things like that. How do we help families to be able to navigate the system and receive the information? And part of that is to make sure that the key personnel who have that frontline, face-to-face, hands-on, connection with these families, they need to be informed. So we're doing that, as well as we're creating like online trainings that can be used either for onboarding or for professional development at the agencies, that everybody will know. And it's great because I have a subcommittee of state partners that are part of this to make sure that we get everything in there. But, and it all sounds great. It's a lot of work. And Massachusetts is a tiny little state, and just trying to get something to work in Greater Boston and then out at the Berkshires, where out in Western Massachusetts, they don't even have good internet service. I mean, if they have internet at all. So Governor Baker is trying to do that. But yeah, so, but this is our goal, is to really raise awareness across the provider networks of how to support these families, and then to communicate it out to all of these other programs that are responding to the same thing. Because the one thing that we don't want to do is duplication of services. I
Right.
mean, this is the one thing. And I just have to, on a side note, Susan, I have to tell you, I have worked in Head Start programs for 10 years, both at the local and the regional level. So when you said Head Start, I was just, I totally get that population. I've worked in there. I'm actually I'm an alum of a Head Start program. So I was in the
Great.
very first Head Start program. So it tells you how old I am.
Yeah.
With side driver. But yeah, I mean, even in that population, so looking at, Head Starts and early childhood and things like that, it's really, really challenging these days, to meet the needs. The calls, the frantic calls that are coming in, it's
Yeah.
rampant. It's frustrating.
So a couple things, and we'll go around the circle and get a catch up, but you used the term onboarding. Would you tell me what you mean by that?
Oh, yeah, so it's when, with new hires. So
Okay,
it's often HR orientations, sorry, we call it onboarding. So
no,
when you
that's
have
great.
yeah, so it's, it's like a new hire orientation.
Yeah.
Yeah.
So this conversation made me think of the conversation we had during the research summit about access. And you talked about the difficulty of navigating the system and how individual people referring themselves don't know what's going on. So that the one-stop shop, kind of a no wrong door approach.
Yeah.
1-800 number sounds wonderful. So talk to us about how that fits with sustainability. I kind of know what you're doing collaboratively, but just to say aloud to the group how this beginning work will strengthen a structure you expect to last, or you
Um,
hope will
that's
last.
I hope will last. Yeah, that's my plan is that so right now I'm working very closely with the Massachusetts Rehabilitation Commission. We're doing focus groups and surveys, and we did a statewide survey, but the sustainability will fall within the central call center, the video. So the video will be sustainable. That will be done. That will be disseminated out all across the state agencies. I do have some sort of champions from the state leadership, which I hope to use them to talk with other state leaders. We do need to identify, this is one thing that the group recognized, we do need to find sort of a champion within the legislators. And so who that will be, I'm not quite sure. And so I'm working with the community partners to identify which one that will be. The one thing that will be challenging for us to sustain is the call center. And so we're really using this year to be able to track the calls coming in, the referrals being made, and then to talk with the leadership about the 2022 budget to support that. Or would that be, no, I'm sorry, it would be the 2023 budget to be able to support that, because we'll be able to support it for this period. But that will be the one thing that will be challenging. As far as a central location for a website, the state's math.gov does have a caregiver page that was developed a couple of years ago. And so we are trying to sort of dust that off. It's been underutilized, the caregiver page on the state website. Because it already exists, this team is taking a closer look at how we can update the information and make it more accessible for families. Since it's already there, it's already covered under the state website. We don't have to worry about, annual costs for, and then IT maintenance and things like that. It's already being done. So just identifying who manages that and how we get new information on there will be just the key piece. But that's an easy fix, we can do that. So yeah. So it's just really the call center that's going to be the one that I'm going to really have to focus on sustainability for.
The video is that we talk about creating permanent products so that that information isn't lost, and video to me seems like a really smart and powerful way to do that. The other thing that I hear you say that is so important for sustainability is about the call center, that you're collecting data to inform what's going on and to inform your decisions. And that's absolutely critical for sustainability, to know where you are and know how you need to make a difference. And to show the merit of your work, to be accountable.
Yeah. And it's, it's part of the Massachusetts No Wrong Door. And it's the same sort of, it's the 1-800 age, there's 1-800 age info. So it's all in that. But when we were speaking with the call center and they respond to elders and people with disability, because they respond to that population already, adding on caregivers to that, they should already be adding on to it, but it's never been something that's been specifically addressed. And so this group is really looking at how we raise awareness across all the you know, all the agencies. And so that will be part of the video, is to include this number, you know, as one of the resources for the caseworkers or the care coordinators to be able to refer folks to, as well as the website. But the data, because it's linked with the No Wrong Door, that data is already being collected. So we can just say, now we're going to add on caregivers to that. So they will be able to say, out of the total calls that we've been receiving,
Mhm.
it, you know, this many elders, this many individuals with disabilities, this many caregivers of children with special health care needs, or, you know, caregivers of adults, you know, elders with Alzheimer's, dementia, things like that. So we will be able to do that, and this is where they will refer to. And then the only other thing is, because it's already existing within the state system, it supports multiple languages, almost every language. So it's really exciting.
So you capitalized
to
on
be
the
able to-
strengths that, of the
Yeah,
system.
on just
Right.
something that's already there. Again, trying not to reinvent the wheel. So
Yeah.
just looking, what do we currently have in place? And when
Yeah.
I called them and said, hey, can we do this? They were like, yeah, sure,
Yeah.
of course you can.
So that's so important with
That's
those.
our call on Monday. Yeah.
Yeah, that's so important with those initial partners. I'm looking at the time and I want to hear from
Okay.
other states
Yep.
about what they're doing. Thank you so much. I can talk to
You're welcome.
Leanne forever because she's a data girl. And I love that. We usually have Doris Green, who's not with us today, but we have great representation from New York. Brooke is here from Montana. Tracy's here from Washington. So do you want to, one of you just unmute, hop in and talk about what's going on in your state, kind of where you are in terms of sustainability planning. We have people at the beginning, we have people, you know, like New York, who's done this wonderful plan or is still actually doing some summits and working on it, but has made so much progress. But wherever you are, we'd love to hear what's going on in your state. So hop in.
Hey, Susan, it's Dina Prest from New York.
Hi,
Sorry,
Dina.
everyone, that I don't have my video on. I'm home
That's
today,
okay.
so I don't have it, but
We're excited that you're joining, really excited, you and
yeah, we're excited to be here. And I'm not really sure what Doris has shared, you know, through your conversations, but I'm happy to kind of report. It's interesting listening to Leanne, because we do track through our No Wrong Door and our New York Connects and the callers, and the, you know, how many of them are caregivers or calling to see about supports for themselves as a caregiver, and that's across the lifespan. So I always include that data in our semi-annual report for lifespan respite, and it was really surprising to me that, you know, because of the pandemic, I mean, I knew that we would see an increase, but it was a 13% increase in that 6-month period, which I thought was, you know, just kind of showed how the needs really increased for our caregivers. So that made it 23% of the callers were looking for supports for themselves as a caregiver. And I guess the other thing I just did listening to Leanne, thought I would chime in, you know, I think it was interesting with the summit that we have held, and we were, you know, all in intentions of holding another one this past May to continue the work with our sustainability. What was really surprising is I've always thought that our state has been very strong with our No Wrong Door system. You know, we're looked to as a leader. We've consulted with other states and kind of how we've implemented, and in listening to the participants at the summit, what was really surprising to me was that the navigation and the difficulties of navigating the system still seemed to come up. So that was something that just stood out to me, I guess, and thinking about here, we thought we had this really good infrastructure built in. It's still an area where I feel like we need to spend some time and continuing to work on. We have a requirement with our ADRC, our local New York Connects programs, that each of them in every single AAA area agency on aging, which there's 59. So our ADRC is housed, you know, within our umbrella of the State Office for Aging. We have program standards that requires each one of them to have a long-term care council. So they are required to have a council locally within their county that is again, representation of all disciplines, all ages, any partnership of these organizations that work in providing long-term services and supports. We also invite caregivers to join the council,
Great.
so you can hear directly from them. And so we require that they send us a listing every year of who is part of their council, and then we also collect their meeting minutes. And I do think that structure seems to be really good, where when, the callers are calling the 800 number and getting connected locally based on their zip code, that those information assistance specialists, they are going to these meetings, typically monthly, for these council meetings, and have built a rapport and a connection with all of these organizations, which makes it so, I think, beneficial in proper referrals, knowing what exists out there, getting people connected appropriately, and then providing that follow-up and making sure that they're satisfied. So it does seem to be really good. What I would love to see, it's just part of our sustainability plan and maybe something we can look at doing. We've been hearing, and I know one of the, they were one of the awardees. I know Doris just actually had them on a monthly call and kind of honoring them of being a recipient of the award for their respite program. But the under our Department of Health, there's the Alzheimer's disease initiative that there's funding for. There are 32 of the area agencies on aging that participate in that. But this particular program, I thought it was really interesting, and I've heard this from some of our colleagues, that they designate a care navigator, which I think is kind of cool, because I think, the New York Connects INA specialists, they're great, but they work with anybody who calls, whether it's the individual themselves, whether it's a social worker, a discharge planner, no matter who it is that's contacting them, they work with them. But I almost wonder if there would be benefit to having a staff that's more designated and working directly with caregivers. And I don't know if any other states do that. I'd love to hear if they do. It does seem like under this other initiative with the Alzheimer's disease caregiver support initiative, they've have designated staff to be, specifically working with the caregiver.
So that I can tell you from my background in early childhood special education, when the law, the public education law started including infants and toddlers, that's exactly how Washington State did this. We had care navigators, and during the research summit and the discussion about access, there was a discussion about touch points, about the people and times when caregivers realize, oh, they have a diagnosis of a child with severe chronic health conditions, or a disability, or an adult with a disability. When you suddenly realize you're a caregiver, there's some professional you're interacting with. And part of that initial conversation should be the professional should connect that caregiver with a care navigator of some kind, so that we don't lose people. And that can happen in different ways too. It might be, Tracy, you do a lot of work with tribal nations, and you have some really wonderful pilot projects that have occurred in Washington State. So figuring out who those touch points are. So Dina, a couple things stood out in terms of sustainability for me. When you talked about your no wrong door system, you mentioned that people are still having difficult navigating the systems. And one of the things that tells me that's important about your collective work is that you're having difficulty. So that means you're collecting some information, and that's absolutely, again, critical for sustainability. If you don't know what's going on, you can't really tell if it's working and what you need to do to sustain it. And the other thing that you talked about was your ADRCs and your AAAs must have a long-term care council. And another hallmark of sustainability is that shared leadership, and it can't be top down and it can't be one person. You have to really build that. Nadine Walter's not here today, but Oklahoma is such a good example of that too, of building a strong system of leaders at all levels, program level, regional level, state level, so that when one person leaves, the system continues and it continues to be strong. So that was wonderful. Tracy or Brooke, do you want to give us a little jump in and tell us if you have anything to share? We'd love to hear from you.
I can just tell you a little bit what's going on in Montana. Recently,
Great.
we've been, part of our grant this year was really helping recruit respite providers and get them registered on our website. I mean, part of the sustainability, of course, is funding, but if we take out all the admin piece, hopefully people who need a caregiver or a respite provider, or a caregiver who needs a respite provider can still go find a respite provider, is our hope. So we had this grand plan to go around the state of Montana and hold little trainings and recruitment events for respite providers. And we're going to partner with the local AAAs in the area and had this grand scheme of this roadshow, we were calling it, and then the pandemic hit. And so we really changed our efforts to have it be an online, more on-demand program for our respite providers, which I think ultimately will help us long-term again, because now it's sustained. It's a training that we've created, recorded, it's going to be on our website. And so it ended up being a better plan anyway. And so
Right.
it was kind of intimidating to think like, oh, it'll be around forever as we were making it, but it was fun. And we had, caregivers come and talk about the experience that we'll have in the video, and some PCAs that we'll embed into the video. And so I think that will be really good. We've also been working on that sustainability piece of working with maybe some of the 3E funding from the AAAs and Alzheimer's grants and such. We have a governor coming in that campaigns messages is cutting 30% of human services in Montana,
Okay.
or tax dollars, which is human services. So trying to figure out how that's going to work. We're approaching it as maybe if we can get in the governor's budget now, then at least it's a talking point.
Yeah.
For why would we take it out now? There's been a lot of hoopla around every time we get the federal grant. The governor comes and we have this big, televised, thank you federal government for this funding, and respite's so important and needed, but the state has never kicked in $1 for it. And so that's kind of frustrating, but hopefully we can get some wheels going there. And then if not, just looking at like that 3E funding or some of the other organizations across the Public Health and Human Services Department that uses respite. We also serve people, we're a Part C serving program as well. And so, and adults with disabilities. And so we really have the whole gamut. And I just want to make sure that we're not leaving those folks out as we look at sustaining, mostly focused on the elderly or those with Alzheimer's.
This is wonderful. One of the things I love about what you said, I loved your presentation at the grantee meeting. I have to say, I was just so delighted by the work that you're doing. And I'm so impressed that you found a way to keep that going during COVID, and then it turns out to be a good thing. You said part of sustainability is funding, but then you immediately jump to the other resources that you have, so that you're thinking about resources as diverse as like partners, programs, recruiting respite providers. Those are all resources. It doesn't just have to be grant money. So I love that thinking. And then also advocacy to keep it going, and which is going to be a struggle. I think we're going to have some really tight state budgets for a while. So again, the keeping it going at some level and some way is really, really smart. So good.
Thank you.
And Tracy, I'm really giving you short shrift because we're down to 7 minutes, but Washington State actually has had some transition in leadership, which can often mean the diminishment or demise of respite. And Washington State is a notable exception. Also, really strong data collection and sharing of data. Tracy and I have not ever been in the same room, but the coalition meeting that I went to, you did it, you opened up with this really beautiful data presentation that gave an idea of what was going on in Washington State. So I've bragged a little bit about you, but do you want to tell us what else is going on?
Sure. Thank you so much for keeping the circle going and open. I'm really just taking in so much, and my head is whirling in a million different directions. So I'll try to organize my thoughts. But again, from my vantage point, the one setback that we had, which was actually a golden opportunity, so no disrespect, because I will be mentioning the fact that the person that came with us, so we started, our organization started this work with Lifespan Respite in 2018. So I consider us still a baby, even though Lifespan Respite has been a long time in Washington, right? So I am madly in love with respite. My background is people with disabilities, and so our organization is the Parent Training and Information Center for our state, family to family. So all of the early intervention, special education, and I'm a New England transplant. So thank you, Leanne. It's just a delight to hear your accent, not so much from New York, but that's all right. I mean, that's my home place is Connecticut, New York. So it makes me feel at home. So that's exciting. But I've been out here for a bazillion years. From my vantage point, we lost our full-time employee, and it was the day that we closed the organization. So it's always going to stay in my mind on March 16th, and then because that's when we closed for COVID. So we have been, keeping everything sustained and going with a part-time person that is dedicated to our respite providers. And then another director of a multitude of programs, myself as the executive director for the organization, and a phenomenal person that we have for our data. So, I mean, again, she and I are always in there. So from the standpoint of that, we've just really hunkered down to how can we utilize the data and how can we help move people forward. So again, access, the whole issues all across the state for individuals just being plowed with all that's lying on them. The thought of trying to call, even though you could research, even though you could segment and search by our 54 providers, was just daunting. So when you all were talking about data and stress and just the technology and the access pieces, I mean, that I think is still a core living, breathing space among our recipients. And we're finding, though, that they're starting to come out. So it's almost like spring in the fall, in a way, where people are starting to go, okay, I think I can peep my eyes up. And you gave me a whole listing based on the care providers I wanted in home services in my county. And it has the phone numbers and it's in, larger print. And I can print this out or just look at what you emailed me. I think they're starting to peep their eyes around. So that's really, really good news for us. It's really, really good news that on October 1st, our full-time employee is with us. I've worked with her for 6 years when we did a military parent technical assistance center for the nation. So it's just her and I for the last, 4 years. This had its own website, all TA. So I'm really excited. She's in Vermont. So we're really excited to have her on our team now. That's really going to help us out. So we're really focusing her on the customer service, website development, and our new ACL that we just, the 3-year grant. That's what we put in there. We put in a lot of 1 through 5 support, care packages. How can we do that? We just participated in the Tribal Summit in September. And again, there's a lot of innovation going on with calls and everything that was laid out in a lot of the part of the report you're able to share with us. Mm-hmm. And so from that vantage point, I think we have our sustainability will now pivot, and I think we can really lean into really writing something and crafting something to guide us for these next 3 years. But I would say it's in that partnership development. We have a lot of these relationships from a varying vantage points, but it's time to reshape that. And it's time to renew and be strategic in what we're doing. I think that's the big push. And that really, this is the first time since 2018 that has allowed me to be a partner to be in that versus before it was always on, how are we designing our system? How are we getting it up? What do we need to tweak? What do we need to step back and do? And then building our coalition. we are just doing it every other month now. So I think, from that vantage point, we're starting to lock in a strength for partnerships, because there's just a lot. And then my last little piece that we did is actually somebody from y'all's area, actually in the DC area, but I think she's originally from Canada, Lisa Dinhofer. I happened to go, it was, I think, a nonprofit HR that I first got introduced to her. And so we just signed our retainer to bring her on board. Even though we have an employee assistance program, we just are really seeing that our entire staff, it doesn't matter where they're working in lifespan or in special education or in family to family, that frontline uncertainty, everything that's happening to our staff.
Mhm.
And in our state of Washington, there's that huge divide that we're seeing nationally of, BIPOC members having a higher incidence of COVID and families.
Mhm.
So in a dovetail, retainer for their well-being, we're signing on. So it's one-to-one coaching. It's not going to be mental health, but it's one-to-one coaching to build our staff's resiliency through these times, meeting them where they're at. Starting in November through March. And so it's an opt-in process. And then the other piece about that is our focus on the next 3 years is really people, BIPOC community members utilizing Lifespan. Our data shows that that's very, very low, and we need to work more strongly with our partners. And I'll zip it, it's 10.
No, that was fast and really good. Good. We're right at 10 o'clock. I opened up with this, but I just want to reiterate again, Washington is so strong at collecting data and knowing what's going on and getting the data out to people and making adjustments, data informed adjustments. And so I applaud you on that. Really interested to hear more about the one-to-one coaching to build staff resiliency. And we'll pick this up later, but you mentioned that there just are populations that you're missing and that you kind of need to find. And that was a big discussion point at the Research Summit on Access that we can talk more about. What else did you said so much, trying to find everything. The partnership develop you talked about for sustainability. It's I'm not sure how you did it in Washington State. I mentioned it. I've known about PAVE for a long time. I first moved to Seattle in 1990 when I went to work for University of Washington, and PAVE has had a strong presence. And I think that maybe that's what's helped sustain the respite work over time, that you were already a strong organization and you already worked with populations, and it was easy to keep things going. Maybe it wasn't easy from your standpoint, but anyway, but we're really glad that you're keeping things going, that you're thinking about sustainability, and that you're thinking about writing a plan. So before I let you go, I'm already 2 minutes over. I've been collecting resources over the last 2 years, and some of the issues that came up in these resources, like collaboration, like having a framework for sustainability, I'm putting those in a list with links. So I'll get those around to you so you can all look into that, see if anything is helpful. And I just want to thank all of you. I'm so much smarter at the end of these calls. Jill, do we usually meet in November? You got a better memory about this. What do we usually do for the holidays in terms of meeting?
Let's see when Thanksgiving is this year.
Okay.
Oh yeah, the fourth Friday next month is the day after Thanksgiving. So I would say we probably don't want to meet then.
Yeah, I would say not, and then and then we'll just look at the December calendar and get back to you.
Well, that's going to be then Christmas. So
I know.
why don't we think? Is there any chance we could meet the third Friday of November, so you don't miss so much time? Or is that too soon to meet?
That's my wedding anniversary, so I might not be available.
I mean,
November,
one thing I actually
right?
wanted to suggest for a meeting soon would be related to writing for your federal grant. Because Montana and Massachusetts are both going to be eligible to apply for a grant next spring.
Okay.
And I'm wondering if Washington and New York and Oklahoma might be willing to share, you don't have to share every detail, but share what you included in your most recent grant proposal around your sustainability plan, because that is a requirement for the proposal.
What
And
would
then
you
it will
think?
help Montana and Massachusetts think about what they want to include in their next proposal for a federal grant around sustainability, because it is an important part of the grant
Yeah.
So
proposal.
maybe instead of doing our regular one and in service to our third goal of like supporting one another, we could send a doodle poll around and have like a special sustainability session around grant writing.
Yeah, can
and-
I just, did you say November 20th? So the 27th I wouldn't be available, but if it was the 20th, I would be available if folks are free then. So I think I might have confused the date.
Okay. And
So
we can
if
go,
November 20th works, yeah.
if it's a special session too, it doesn't have to be on the same day and time. Does that sound like something that would be helpful? And
I just throw that out as an idea for,
I think it's a great idea. And I think it really is in the spirit of what we want to do to support each other in
Yeah.
sustaining our work and being successful and bringing in money. It helps.
If you're gonna do a doodle poll, that's great, but I'm with Leanne. The 20th works for me as well. Anything
Okay.
before then, no way. I've got 2 virtual events pulling off that week, and the 20th, I'll have myself back.
Yeah.
Okay.
The 20th would work for me as well.
Okay, great.
would New
Right.
York and Washington State be willing to share what their sustainability plans were in their most recent proposal?
Yeah, of course. This is New York, and we're available the 20th too.
Okay, great.
And I
Of course, we'll share. We're always willing to share.
Great.
I hardly
Thank
have to
you.
ask that question, but it's.
I know. It's such a
That's a
great.
great group, yeah.
Yeah.
And Tracy, I'd love to be able to talk to you offline about your one-to-one coaching. I don't know if that's
Absolutely.
something- Yeah, it'd be
Absolutely,
great.
and I can,
Thank
if it's okay, I could also just email everybody afterwards off of Susan, your email, and I'll just
Yeah.
share with you Lisa Dinhofer. She's remarkable, and I can give you the webinars you could watch for free
Oh.
to see her background.
Yeah.
So
Yeah.
she's dynamite.
Yeah.
Great.
Yeah. We'd love that.
Great, thanks.
Thank you. Okay. Thanks to everybody for staying
Yeah.
6 minutes late, and have a wonderful life in the time of COVID.
Yeah, I know, be well.
Okay. Be well.
Be well,
everyone.
everyone. Thank you.
Stay-
Thank
stay healthy.
you.
Thank you, bye.
Thanks.
Bye.